we're going to start by doing a review on a document that came out 2022, and it's from the Future Today Institute. And they did this review on the trends in technology and science that are influencing the future of healthcare, medicine, and pharmaceuticals. So let's take a quick look. We're going to start with a Twitter video of an influencer, huge influencer, that's talking about the work that we've been doing. And this is interesting to me because as we see this influencer that has millions of followers, we will be able to understand why we are legitimate in this space and how our work is right on in what's interesting the world right now.
It's very clear now from work, some of which was done at Stanford, but elsewhere as well, that the nasal microbiome is particularly good at scrubbing bacteria, at preventing certain types of infections. So this is a reminder that whenever possible, unless eating or speaking, you want to be nasal breathing, not breathing through your mouth. Your nose is a much better filter for viruses and bacteria than is your mouth. The mouth contains certain structural features, even organs and cell types that can protect against incoming infection, but you don't want to be a mouth breather for a variety of reasons. And there's a terrific book called Jaws, A Hidden Epidemic, which was written by my colleagues Sandra Kahn and Paul Ehrlich at Stanford and Stanford Medicine, with a foreword by Jared Diamond and Robert Sapolsky. So it's really a lot of heavy hitters on that book that talks about the increase in infection that one gets when breathing through the mouth as opposed to the nose. Now, of course, during hard exercise, one breathes through the mouth. That's not necessarily bad. When one is eating or speaking, that's not necessarily bad at all. I guess it depends on what you're saying. That was a joke. But in general, when possible, you want to be breathing through your nose.
It's interesting to me that the first slide, as an example, they're using the digital fitness and training, which is absolutely where our device and our program, because it's not a gadget, what we have is a full program with the data. The device is going to gather the data. So our company is going to be in that space in the fitness and training. They describe different possible scenarios and different things that are happening in this space. Here's the URL. If you guys want to look at more trends and look in more detail, you can go in this URL and find out more about it. So what are the insights? Basically, big tech is doubling down in this disruptive healthcare industry, and it's recognizing that there's different strategies that can be utilized. Membership-based services, I love this part. I've had this in my practice, and membership is always good because the patients want to continue, the users want to continue, and this is a good way to introduce the product and the system, the technology, without such an entrance barrier. We create new models that fit the needs and the lifestyles of the younger digitally savvy generations. And this is also telemedicine, which is disruptive, but it's what doctors want. It is what users want. They want to do telemedicine, not necessarily medical, because we're starting as a consumer product, but it is something that the younger and the savvy users want, this the information to be in charge of their situation. The technology is bringing powerful tools and everything into our homes. There is breakthroughs in sensors. This is very exciting because since we started designing this about 2 years ago and to where we are at now, the sensors are getting smaller, more efficient, and easier to adapt into our technology. The sensors are getting better, there's breakthroughs, and artificial intelligence is learning every day and expanding the possibilities of all this remote care. The scale is getting bigger, and we are also using games, and we're generating all kinds of interesting ways to bypass the problems in the past with compliance. So games, algorithms, anything that's automatic and can adjust to the patient is definitely on the rise. And we are now talking about the wellness community that go beyond patient care into, using all this technology to improve the situation of people that not necessarily sick, but are in the wellness. They want to live longer, more quality of life. So all this remote patient monitoring and in improving the way that a patient breathes and rests is definitely fitting this new trend. So we have doctorless exams. We're talking about telemedicine and the fact that artificial intelligence is learning. One of the big examples for me, it's Invisalign, which has an algorithm that beats every single orthodontist in the planet. There's no one can beat it because of the number of cases that have been treated and how technology has learned on all the different possibilities. Laboratory tests, we know this is important, telemedicine, and with the pandemic, we find out that this is incredibly worth it. The patients want it, the user wants it, the doctor wants it. The industry is really, really proven that this is the way to go. We like direct-to-consumer healthcare models. Consumers are savvy. They go into Google, they find out things, so we want to go directly to the consumers. We don't want to have to bypass things that have to go to the doctor or approved. We're going directly to the buyer. We have this disruptive technology because it's changing how we think about rest, how we think about breathing, and how we think that the patient can self-monitor and self-improve his own situation, his or her own situation. So the big tech is doubling in this space. This is quite big. And they're reorganizing, they understand what didn't work, and they're shifting their strategies to be able to deliver in the space. We all know Apple Health, it's huge. We know about the watches and the monitors, and now they're doing things that improve not only the diagnose, but also the treatment. So Apple is one of the big players, and it's disruptive, but we are designed to fit in with these companies. Amazon also has a lot of ambitions in this space, in pharmacy, a delivery company or a purchase company, but they're in analytics, in pharmacy, in grocery stores, in telemedicine, in diagnostics, and the big space, which is health and wellness, that is a very, very profitable area. We know that prescription strength of gaming is being used already to keep the patients compliant. So we have a system, very simple. We're not inventing new technology. This is not, space age stuff. It's something that already exists. So you're plugged into your game, or you're watching, and it could be done for younger patients or older patients. We have all these tools that can help us disrupt the space and partner with companies that are already looking for alternatives of how to utilize the technology that they have to deliver more services. Medical misinformation and disinformation. This is very important because we know with the COVID situation, we had a lot of people go and misinformate patients. Our technology, our system is very solid. It's based on research, on medical doctors like Dr. Engelke, who was the head of a hospital in Germany. So we are prestigious researchers, physicians, and we want to stay that way. And we want to make sure that we hold any misinformation, because the people, the users of the systems, they're already looking at many, many places. And we have the legitimacy through our research, through our books, through our clinical experience. We can back up whatever claims we have and show where we're going. We also obviously need to have a proof of concept and measure the treatments and the diagnosis and make sure that what we claim is really based on science. The extended reality is great because it allows the doctors to see the patients before, during, and after treatments or after diagnosis. So this is really an area that is well received by the medical community. Brain-machine interfaces. This is very interesting because in our space, we are utilizing rewiring of patterns, of neurological patterns. In our GOPEX program, we did it by repetition. And with our new devices, we are making sure we're practicing meaningfully so that we're practicing this new pathway that can become second nature, so that it can become automatic. And when the patient goes to sleep, they are resting properly, or anytime we're resting, that our brain pathway will go to the best possible rest. Delivery of healthcare, we are delivering not material, but we are delivering information and this data. The data is really important. The patients now are savvy, the users know they have data, and we have models to keep that data secure. So it's their data, they own it, but they can also do things with the data. They can share it, and they can share it with us for a discount, so that the use of the system is very inexpensive, lowering the entrance barrier to our devices. But they can also keep their data, not share it, keep it secure, and we can guarantee that for them. That will involve a more expensive usage. They can also choose to share it with their physician. They can share it also with their insurance company for discounts. So this is in the future, but the data is really where the value is. This biometrics, this data is huge, and the industry knows it. Transcribing also, it's one of the things that us as clinicians, we spend a lot of time transcribing. So if there's anything that helps us with this, it's incredibly useful, because then we don't have to spend that much time after work doing our notes. So if we're going to be transcribing, and this appliance gives us the data in an organized way, we have Excel charts, and that goes into a patient chart, and we can just make sure that this is double checked, but it can also give a lot of benefits to the patient and the healthcare system. A remote patient monitoring, the doctor or anybody can be aware of what's going on at home. Remote patient monitoring in our system, not initially, but later, a parent can monitor if the kids are breathing correctly or not while they're watching TV or when they're with grandparents, so the parent can actually check the children in the future. So remote patient monitoring, very important, growing, and exciting in that field. This is where we're starting, which is fitness and training, and we want to stay away from the medical side for growing the company and for delivering something that has less oversight from FDA or from claims that we are achieving benefits that are medical. So digital fitness and training is a big trend. We have the experience from Peloton. The pandemic came, but Peloton was already in the rise. And through their experience, we know what to do and what not to do. So this digital fitness and training is not going away. There's some big players, and we are in that space, and we know that this is going to take off, and this is where people are spending big money. Personal trainers, we want to be healthier, and we want to personalize. So the data with our devices is specific to the user, and people really want personalization. So this is also a trend that's growing. Neural optimization, people like me, menopause, 60 years old, we want to make sure that we optimize our brain. This is a priority for a lot of people, and we are making sure that by breathing properly, we're optimizing the nitric oxide and the neural receptors in our brain, and how we utilize the oxygen to have better brain health and long-term optimization of our minds. Health and wellness, again, this is disruptive. People want to be well, but they want to even be better than well. So health and wellness is an area that is growing and that people are going to spend money in. We know from the glucose monitors that now healthy people that don't have diabetes are now requesting these monitors. My trainer at the gym, he has one, and he says, I want to know what my blood sugar is so that I can customize my training. He's not diabetic, he's not sick, but he wants this wellness higher level. Our device will give him that, because every breath will be monitored, and we can know how to make every single breath a better breath. This gives people options, multiple pathways, engage in their own care, do things how they want it. And this is what the market wants, and this is what we see that is a trend with people that want to get care and want to improve their health. Wearables, again, this is where we're at. It's very exciting that wearables are well received, and we have very different examples of wearables, and the interfaces are varied, but there's every day more things that we can put on our body, and people are accepting of this. So putting something in the mouth, initially we designed the components outside the mouth. Now our new design has them in the mouth because there's better technology, and wearables are already proven to be safe, and we can use these wearables for having smaller appliances and having be less intrusive. This is one of the similar products that are in the market, and it's very interesting. We are similar to this, where our devices go in the mouth with all materials that are FDA approved because they're in the mouth, but they have the technology inside of them. They have the sensors, and the sensors are smaller, safer, and they give us a lot more information now. So this is extremely exciting for me. There's tattoos, there's dissolving biometrics, and there's nanobots. So we can continue to make this technology better, smaller, and more comfortable with more information. People are accepting this, and they want to have something in their body. Sometimes they were a little bit hesitant to do that, but now we have so many of these that the market has proven that this is something that the market wants. We have different clothing and different smart biohazard wearables. We have skeletons that are worn on the body to give us information, and a lot of different materials that are emerging in this space. We know the watches, the Apple Watch, very well accepted. The rings, like the Oura rings, bracelets, hearables, wearables, and there's not a lot of stuff inside the mouth. So we are in a space where very unique, because we can gather a lot of information, and we can create treatments and customize things inside the mouth. And this is a space where there's a lot of leeway for us. There are smart glasses, smart shoes and gloves, and things that you can put on your head, but there's not that much inside the mouth. And there is a lot of different steps and different things that we can add to our device as it becomes more user-friendly, and we have it. The way we have customized the business model, or the business side, is that the patient will have a lot of different options, how they want to own the device, if they just want to lease it, if they want to pay a smaller monthly fee, or they want to buy some kind of insurance so that if they lose it or they drop it in the toilet, they don't want to put it in their mouth, they can just get a new one, they can purchase insurance. And depending if they allow us to own their biometrics, the data, or if they want to own it securely. There are different levels, and we can show you what our proposals are, but there's definitely a very, very interesting subscription model here, because the important thing is not the gadget, but the data, how you see it, how you maintain it, and how that data is learning with the artificial intelligence, how that data is knowing who you are, and it's customizing the data for yourself so it can be compared in case something goes wrong. So we have strategy, innovation, research and development, and we are in a really big growing area. So with this, I'll leave you with the key questions that you might have. There's some here, but we can definitely schedule some time to give you some answers that are specific to our product. But in this summary, you can see that this is definitely something that's hot, and it's a huge opportunity to get in at this time. It's in our home, it's disruptive, it's profitable, it's related to health and wellness, and that has a huge growth opportunity. There's a business model that is solid, and the biometric data is extremely valuable. Big tech knows it, and we can deliver a lot of this, and we can create strategic partnerships with bigger companies. So this is really good for our company because we can be profitable. We've already proven that we've gotten this far with very, very little expense. We've grown the company on a shoestring, so we can be very profitable. This is a growth industry in every part that we are touching, in every way you see it, and it can be improved. It already is improving. This technology is improving every day. So the future of this is big, and we can work with you to create the models that will become extremely good business. This is just where the information comes from, and if you want to look at it, and you can go to their website and contact this company if you have more questions. But I think you will find this interesting. Thank you for your attention.